welcome to our third live Facebook session, and I'm here today with Professor Paul Booton.
Hello there.
And yes, we are going to be discussing what causes headache. So please do send in your questions. I'll be checking them, and we'll try to answer as many as we can at the end. So, Professor Booton, the first thing I want you to answer is migraines and headaches. What is the difference between a migraine and a headache?
Right, okay. Well, migraines are a particular kind of headache. There's not one sort of migraine, there's quite a few different kinds of migraines, but there's lots and lots of different kinds of headaches. We work from a thing called the International Classification of Headache Disorders, which is the big sort of manual of different types of headaches. When we did the trailer for this, I said I thought there were about 200 headaches. I actually spent some time looking it up. There's near 400 different kinds of headaches, of which migraines are just part of that. That said, migraines are on the whole the more troublesome headaches and the more severe headaches and the ones that bother people more.
Okay. Now one of the sort of more common headaches I've heard of is tension type headache. So what is tension type headache? Is that different to migraine? Is it?
Well, it's good. What you're meant to do with these sessions is you start with an easy question to soften everybody up. Actually, this is quite a difficult question. Classically, when people describe tension type headache, it's a headache like a band round your head, it's often described. It's not terribly severe, it's often related to being under stress or under pressure. It doesn't bother you in the sense that it's not particularly disabling as a headache, it's a nuisance, but it's not more than that. Now more recently a lot of people have questioned whether that's in fact completely true, and it may turn out that tension type headaches are actually a kind of milder form of migraine, a rather featureless form of migraine. So it gets quite complicated.
Okay, it's interesting. I've had that before actually. Yeah, so a lot of our patients also ask, they talk about eye strain, they talk about neck tension, high blood pressure, and saying that those actually cause their migraines. Are those type of things actually causing the migraine itself?
Well, rather than say causing migraines, do these things cause headaches?
Yeah.
Eye strain is one that people often mention to me, say I had this headache and I went to get my eyes tested. Eye strain isn't really a cause of headaches. Now if you're if you're sort of in the 18th century adding up columns of figures under a single candle light, well probably over a time if you're sort of staring away you might get some head pain. It's not really a cause of headaches, that. So I think the advantage of people believing that is that they go to the optician and get their eyes checked, and we should all get our eyes checked, you know, once every couple of years or so, just to keep our eyes healthy. But does it cause headaches? No, not really, not really. That's one. Blood pressure. Again, a lot of people, they come to their GP, they came to me as a GP saying, I've got a headache, can you check my blood pressure? And that's a sort of great news for a GP because it's always good to have an excuse to check somebody's blood pressure. But again, blood pressure doesn't normally cause headaches. The only exceptions to that are people with extremely severe blood pressure, so severe that they're at risk of getting a stroke from it. And I'd have to say in the whole of my professional career, I've only seen 2 or 3 people like that. That's very, very unusual, that. And in those people, yeah, certainly blood pressure can cause a headache, but for most people it doesn't. But it's a jolly good excuse to get your blood pressure checked, and that's important.
Yeah, and what about the neck strain? Is that also something that people, you know, sort of having tension in their neck, can that cause that?
Neck strain is a chicken and egg special.
Okay.
It goes both ways. If you've got pain in your neck, it can certainly produce headache. So people with arthritis, say, in their necks, they can get pain around the back of the head and over the head. If you're a migraine sufferer, then it can be one of the things which feeds into triggering your migraine having a bad neck. But it's also the other way around, particularly for migraine sufferers, it's very, very common to have pain in your neck as part of the migraine. So a lot of people come to me and say, it's my neck, doc, and the answer is no, it's not, it's your migraine which is making your neck hurt, not the other way around.
Just figure out which way around it is.
You've got, yeah. But we're paid good money for this sort of thing.
Yeah. So now another one I've heard about is sinus headache. People talk about having sinus headache.
Yeah.
What's that, and how would you treat someone that suffers from sinus headache?
Well, sinus headaches are important because actually most sinus headaches have nothing to do with your sinuses. I see an awful lot of people with sinus headaches. Overwhelmingly what they have got is migraine, and it's worth remembering with migraine is that you often get a stuffed up nose as part of it. You can probably hear I've got a stuffed up nose, not because I've got a migraine but because I've got a cold, but that's neither here nor there. So if you're getting headaches and if you've got a stuffed up nose as part of those headaches, the chances are it's migraine. For sinus headaches you need more than that. You need to have signs. What sinusitis is infection in the nasal passages, in the air passages behind the nose. And if you have that, you get pain mainly around your face, mainly in the sort of front of your face where the air sinuses are. And you also get a discharge from your nose, and it's a nasty, yellowy, sticky discharge, which is a sign of infection going on. And that can certainly give you pain. That gives you sinusitis pain, but it's not a pain which comes, every few weeks. It's a pain which comes once in a blue moon when you get a sinus infection, for most people anyway. And this is very important because I meet a lot of patients who've had operations on their nose, operations on their sinuses, and it doesn't do anything at all for their headache because it was never from their nose in the first place. It's a migraine.
It's fascinating. Okay, and another, I think, important headache that we talk about is cluster headache, because it's also known as suicide headache. So it's obviously very severe, but it's also often misdiagnosed. So how do you know if you've got cluster headache, and how do you treat cluster headache?
Right. Well, that's about an hour's lecture.
We don't have that long.
Cluster headache is a sort of version of migraine, really, but it's a cousin of migraine. It's probably closer to say. With cluster headache, what you get is an incredibly severe pain, always just on one side of the head. If you get it both sides of your head, not cluster, easy. On one side of your head, which comes on quite quickly, lasts for typically around 40 minutes, and then goes away again. While it's there, it's unbearable. People, they're in a desperate situation. You can see videos of people with cluster that they've taken and put onto YouTube, and you see people just sort of rocking and doing anything they can just to try to get some relief. Migraine is quite bad enough. It's much worse than migraine. It's called suicide headache because sadly people have taken their lives because of that. How do you diagnose it? Well, interestingly, Dr. Google, which is much maligned by doctors, but is quite helpful here. The last 3 patients I've seen with cluster headache have all come and told me they think they've got cluster because they've looked it up and it fits their symptoms. And that's quite interesting. They've all been right. They've all been absolutely right. So typically with that, you get this one-sided pain, you get it the same time every day, and you get an episode which lasts for about 6 weeks, 3 months maybe, and then it goes away again and you're fine again. And typically it just keeps coming back at the same time every year. So maybe in the spring and in the autumn. And you sort of map this out, and it's always within those same few months. We've no idea why that should happen. Another thing you get with cluster headache is you usually get some watering of your eye and a red eye. You may get a droopy eye. You may get a blocked nose or a runny nose with it, always on the same side as the headache. That's a typical feature of cluster. And it's important to differentiate it from ordinary migraine because the treatments are different.
How are they different then? What's the sort of... How would you treat sort of cluster instead of migraine?
Well, it probably shouldn't go into vast detail here, but it's just they're different drugs. The drugs which work for cluster don't work for migraine. The drugs which work for migraine don't work for cluster.
Talk to your doctor
on the whole.
Okay.
Well, you need to talk to your doctor, and really, with something as unusual as cluster, you need to get it confirmed by a headache specialist. So you can come to the clinic here, or you can go to see another specialist who's interested in headache to get them to confirm the diagnosis. Some people come to me and told me the doctor said they've got cluster migraine. There's no such thing as cluster migraine. It's one or the other. It's very important to be sure what it is, because if you're not, you won't be getting the right treatment.
Okay. Now, another thing I think our patients often come and they're worried that they have something more sinister, like a brain tumor.
Yes.
And they think, oh, do I need a brain scan? Do I need a brain scan? And
Yeah.
they're a bit worried about that. So how would you know if they need a brain scan? And, you know, what sort of...
Yeah, that's important. So, you know, we're a headache centre here. We see people with all sorts of headache, although we call them migraine centre. We see a lot here. That said, most people have got migraine. And migraine is one of what are called the primary headaches. In other words, there's nothing which is causing the headache. It's just a problem which is going on in the brain which presents itself as pain in the head.
Yeah.
People with brain tumours actually don't get very much of a headache. I was interested to come across the NHS website talking about severe, long-standing pain or something like that with brain tumours. There's not many mistakes on the NHS website, but that's one of them. Most people get a very mild headache. Often they don't even mention a headache. You're much more likely to develop epilepsy, develop weakness, a bit of a sort of stroke-like symptoms in your arms or your legs as part of that. That's much, much commoner. How do we sort it out as doctors? Well, the main thing is taking the story from the patient, finding out the characteristics of the pain, the characteristics of the other symptoms the patient's getting, and if there's any risk that it's a brain tumour, certainly you need a scan. But for most people, it's very, very clear from the story that it's one of the primary headaches, and that a scan is not only not very helpful, but it can be a disadvantage having one.
Okay.
I've sort of wandered around the point. Did I answer the question?
That did answer the question. I
I'm
think that
somewhere
answered
near
the
it?
question very well. No, you
Yeah.
did. Another headache I often hear about, but I don't know much about it, is a thunderclap headache.
Yes.
So what is
Yes.
that exactly?
Thunderclap.
Yes.
The clue is in the name,
Yes.
as they say. So thunderclap is where you suddenly just get a headache like that out of the blue. Sudden, severe, dreadful headache, which often quite debilitating, often with some, you know, other symptoms at all. You muzzy-headed, can't think straight, might have some other signs like, you know, weakness in an arm or something like that. The real worry with thunderclap headache is that it's an early sign of a brain hemorrhage.
Yeah.
And the important reason to pick those up is if you don't spot it then and get treatment straight away, then it can lead to a full brain hemorrhage, from which death or disability is a very, very common outcome.
Oh my God.
So
Very severe.
if people have these sudden, or get a sudden severe out of the blue headache, like nothing you've ever had before, it often comes during exertion. One of the classic times is people are having intercourse and suddenly they get this terrible severe headache due to a sort of rise in blood pressure causing a leak of blood into the brain. You need to get that sorted out. You need to get it assessed straight away. That is one of those times when you need an urgent brain scan. You need to go to casualty. They'll scan you. They may take a tap of fluid from the base of your spine to see if there's been a leak of blood. And if there is at that stage, then the surgeons can go in and fix it, and it avoids the risk of a brain hemorrhage and a stroke. So that's very, very important. Very serious.
That sounds great. Okay, so I think we'll see if we have any questions. I did have one from a gentleman called Chris, and he wanted to know, how do the various senses link to the causation of migraine? And why is it that eyes in particular seem to be affected? And what about tinnitus? You know, why does it seem to worsen when you have migraine? That kind of...
Yeah, okay, that's an interesting question. What seems to be going on when we have a migraine is it's a problem in the brain itself. And the old theories about migraine were about this constricting and dilating blood vessels. And although we know that does happen, that now seems to be a secondary effect. It's not the cause of the pain. What's happening is it's a problem going on in the brain itself. And with the modern research scans that we've got, you can see that happening. You can see the process of a migraine as it takes place through the brain, the different areas of the brain that light up. So we've learned in recent years a great deal about that. And one of the ways of thinking about a migraine is thinking that the brain suddenly becomes hypersensitive and unable to sort of damp down all the different stimuli coming on. I sort of, in a kind of way, experienced this a few weeks ago. I went to have a routine eye test, and as part of that, they put drops in my eyes to dilate them, and then they sent me out onto the street, and so my pupils were wide open, and everything was so bright, everything was so glary, and it's a bit like that with a migraine. You can't damp down those sensations in the way you usually can. So lights are uncomfortable, sound is uncomfortable, smell is revolting. Things like your hearing gets very acute, so things like tinnitus can get worse. And that's all part and parcel of the strange brain activity which takes place as part of the evolution of a migraine. Usually that's happening right at the beginning of the attack, which is why it's called the aura. It's happening before the attack, and then that's replaced by the headache itself.
Okay. So I also had a question from Sarah, who wanted to know about medication overuse headache, because she was just, how do you know if you are suffering from that?
Oh, okay. Well, hello, Sarah. This is very, very important. We see a lot of patients in this clinic who've got, and you know, all headache clinics see a lot of patients with medication overuse headaches. It's very common. What happens is people have got bad migraine, they've got a lot of headache, they're popping a lot of pills for it. In the beginning, that's fine. They treat the pain, they help the headache. But what can happen over time is that pills start to drive the headaches. So you take a pill, it settles the headache down a little bit. A few hours later, the pill's wearing off, and the brain, which is, you know, the brain is going wrong, if you like, in migraine. The brain interprets the absence of a painkiller as the presence of pain. It's a strange business, but that's essentially what's happening. And so your brain, as the painkiller wears off, so it starts feeling pain again. And this then becomes a vicious circle where you get people who say to me, well, I know I'm going to get a pain straight after lunch, so I take a painkiller before it starts, and I take a painkiller before bed, because I know it will start up when I get to bed. And so they're taking painkillers preventively. And one of the things when I'm teaching doctors and students is to say you've always got to, part of your examination of the patient includes the patient's handbag. And you rattle out the handbag, and you often find dozens of different kinds of painkillers in there. And often patients have got really no idea they've been taking so much. It's a surprise for everybody. And it can be the painkillers you're taking can be quite trivial, just ordinary old paracetamol. But taken as a sort of drip, drip, drip into your system, it's gradually producing this. I had a chap in the clinic a few weeks ago who'd developed a particular kind of migraine and had been advised by a hospital to take regular painkillers for it. And it wasn't huge amounts of painkiller, it was just sort of 4 times a week, maybe 5 times a week. And I said, well, look, we better stop these just in case of medication overuse. He came back to me 3 months later and said, I've not had a headache since. And that's typical of this story, that you stop the painkillers and suddenly your headache drops down.
Okay. Dawn has asked, will this be recorded so we can watch it later? Yes. Just to let you know, we will put it up later, and we'll have it on our YouTube channel, and we'll also repost it on our Facebook page, so you will definitely be able to see that later. Now, one for you. Rebecca would like to know, do you have any insight into hemiplegic migraines? The causes, genetic severity, that kind of thing.
Right, okay. Always. Thank you, Rebecca. This is a difficult question. Hemiplegic migraine is well known. It is very, very rare, though. I've had lots of people during the time I've been working in this clinic coming to me saying, I've been told I've got hemiplegic migraine. Most of them don't have it. Hemiplegic migraine means that you get something like a stroke down one side as part of the migraine. You can also get some other quite weird and wonderful stuff with it, but let's just stick for that for now. A lot of people get pins and needles down one side, as part of the migraine. And some people get told that that's hemiplegic migraine. It's not. Hemiplegic migraine is weakness. So that's what's happening as part of a migraine, and it's, you know, understandably, it's a terribly frightening form of migraine to have. Fortunately, as I say, it's very rare. There is a genetic basis for it in about half the people who have it. About half you can trace it through to a family history. About half it just seems to have come out of the blue. Some people, I know a neurologist who had it once, and that might have been why they became a neurologist. But they never had it again. So it's a funny thing, hemiplegic migraine. Fortunately, it's very rare.
Okay. Let's see. I can. Rachel wants to know: are things like cheese and chocolate actually triggers, or could the desire to eat them be part of the reason you get it? So
that's
cheese and chocolate.
That's a good question.
Yeah. We all like eating cheese and chocolate.
What was the second part? Could the
sorry, are things like cheese and chocolate actually triggers, or could the desire to eat them? Oh, I can't actually see the rest of it. It's not coming up on my page.
Okay.
Hold on.
Okay.
Let's see if I can find it for you.
While Charlotte sorting herself out.
Not showing up.
Cheese. there are specific food triggers like cheese and red wine, which for some people are very sensitive to those and it can trigger an attack. That said, it's usually pretty obvious if you've got one of those as a trigger. I get people who've stopped eating one thing, stopped eating another thing. You get people who are more or less living on rice and water sometimes when they come here, with no suggestion that it's ever really helped their migraine. The most important things about diet are eating a healthy, regular diet so you keep a steady blood sugar, and that's the best way to keep a migraine at bay. There are a few people who cheese will trigger an attack, things rich in tyramine, Marmite, such as that. I don't know if anybody eats enough Marmite.
I particularly like the Marmite, I do.
Okay, and you doesn't trigger your migraines?
No.
Okay. So tyranny containing, yeah, sure they do with some people, but it's actually quite unusual. And if it does happen to you, it's usually pretty obvious. So people, I don't ask people about that, they tell me about it.
No.
It's easy to work out, that one. Chocolate is an interesting one, and this comes on to that interesting second bit of Rachel's point.
Yes, it's not coming up. I'm sorry about that, Rachel.
I think what Rachel said was, or is this a sign of the migraine?
Yeah.
Okay, I'm being told to hurry up, okay. Right, so yeah, and this happens sometimes. There's a thing called a program with a migraine. So the first phase of a migraine, which maybe a third of people have, is a change in the way they feel. Some people get the munchies, some people get very tired, start yawning all the time. People get the munchies, you suddenly think, go on, I could do with something sweet. You reach out to the shelf, and a bar of chocolate comes back. You eat the bar of chocolate, the next morning you've got a migraine. The chocolate gets blamed. It was never the chocolate, it was the fact that this is a migraine prodrome and you feeling a craving for sugar as part of that. And in fact there's no very good scientific evidence that chocolate ever produces migraine. Although,
so hopefully we can eat.
Yeah, I think you can eat chocolate with a clean conscience and a swelling abdomen.
Okay, very quickly I'll just say, Faye wanted to know, does a high-fat, low-carb diet help chronic daily migraine? High-fat, low-carb.
Well, yeah, things which give you a steady blood sugar are helpful for migraine. And so those sort of high-fat, low-carb diets will do that, although you should bear in mind there was some research, very recent research just last week, suggesting that in the long run they're not very healthy for you, not from a migraine point of view, but that people who live for long years on that sort of diet are likely to die younger than those who eat a healthy diet. So just a bit of a warning about that. What we're really looking for is a healthy diet where you're eating carbohydrate in the form of sort of rough carbohydrates, so not refined carbohydrates which are broken down terribly quickly to sugar, not too much sugar in your diet. Eating regular meals, keeping that even blood sugar. The standard healthy diet, I always recommend patients look at the British Heart Foundation website, which has got some very good advice on that. That's good for your health generally, and it's good for migraine as part of that.
Brilliant. Okay, well, I think unfortunately that's all we have time for today.
But I can go on for hours.
We'll just be here for the next 2 hours. No. So sadly we have to leave, but I just wanted to say it is Migraine Awareness Week today, if you haven't noticed all our lovely posts about it. But we are trying to raise awareness, especially about the impact that migraine and headache and everything has on your daily life, especially when it comes to the workplace. So, just as a leading note, Professor Booton, can you say what can employers do to help their employees?
Right, okay, yeah, sure. This is really important, especially this week, thinking about this. First thing, take it seriously. Migraine is not someone with a low pain threshold. It's not someone trying to do a sickie. It's a serious condition. It's one of the most disabling conditions as recognised by the World Health Organization in the top 10 causes of disability. You don't help by giving your employees a hard time for being ill. So take it seriously. We tend to find the good employers are the ones who've got migraine, so they know what it's really all about. Second thing, migraine is a disabling condition. You know, it's not much point forcing someone to stay at their desk when their brain is 10 miles away at the bottom of a dustbin. You can't think, you can't work properly when you've got a migraine. Let people with a migraine do what makes them comfortable. If you've got a room which is dark and cool where they can lie down until their drugs have started working, until the symptoms start to pass off, you're much more likely to get your employee back to work again than if you sort of screw them to the desk. What else did you do? What were the other things I was meant to be talking about?
Well, I know that people say that lighting in their offices can be bad. And
thank you for that tiny hint. Yes, yeah. So strip lighting, a lot of people with migraine are affected by that. So for people who are migraine sufferers, one of the things you can do is get them to work in natural light. So put their desk by the window rather than the middle of this vast office floor. A lot of people with migraine are affected by computer screen glare. So having a possibility of being able to take breaks from the computer regularly, that will all help. Looking after the workplace, so you get your desk and the chairs at the right height so everything's nice and ergonomic, so there's not a strain on the body and a strain on your neck. That's all helpful.
Fantastic. Okay, well I think that is all the time we have. So thank you everyone, and we will be doing more of these, so if you do have any topics you want us to talk about for our next live session, then let us know. And hopefully we'll see you next time. Bye.
Okay, thank you.
Thank you.